at Medical Sciences by Naftali Muhumuza. Today we want to discuss about different poikilocytes, what we are calling variation in shape. Poikilocytosis, under film comment, we know it as the variation in shape of red cells, whereby you find under the film comment different types of shapes varying from discoid to dacrocytes, those which are sickle-celled, and other different, which you want to see in this video. And we always remind you to subscribe, like the video, and share your comments as we begin. So we want to look at the different shapes of red cells as seen under Romanowski stained thin film. And we want to start straight away, whereby one we shall begin with sickle cells. Sickle cells are known as drepanocytes. And these drepanocytes, they are crescent shaped. You can say they are crescent shaped, or you can say they are banana shaped, or you can say they are sickle shaped. So these are crescent, banana, or sickle shaped cells. And these cells, they have no area of central pillar. No area of central pillar. And these sickle cells and the banana shaped cells, they have sharp ends. They have sharp ends. So they are crescent shaped or banana shaped with no area of central pillar, and the ends are very sharp. And this, when we are drawing, we see them, they are banana shaped or sickle shaped or crescent shaped with no area of central pillar. And these cells are seen here in sickle cell anemia. You can see them in sickle cell disease, or what we call sickle cell anemia. You can also see them in hemoglobin C disease. But majorly in sickle cell disease, that's where we see these drepanocytes. After knowing drepanocyte, the second cell we can talk about in this different poikilocyte is target cell. And the target cells, they are known as leptocytes, or you can call them Mexican heart cell. And these target cells, for them, they stain at the center, and at the periphery with unstained ring or rim, we can call it rim or ring in between. So you find it is in the center, and at the periphery the area is hemoglobinized, then with in between unstained ring. So when we draw an RBC like this, we're going to find in the center it is stained at the center and at the periphery, leaving a small ring, of unstained. So this is what we call a target cell. These target cells, they are seen in different conditions. You see these target cells in different conditions like sickle cell. In sickle cell disease, we find them there. Find them in sickle cell disease. We find them in thalassemias. Find them in severe liver disease. We find them there. So these are some of the conditions where we find target cells. That is the second cell we can discuss in this session. And another poikilocyte we can talk about is there are those which are due to red cell membrane defect. And these due to RBC membrane defect, one of them is stomatocyte. And this stomatocyte, for it, it has the area of center, it has moon-like. It has moon-like, we can call it slit-like, or you can call it kissing mouth-like. Kissing mouth-like area of centropela. So the area of centropela of this cell is like a kissing mouth, the shape of the kissing mouth, or slit-like or moon-like. So when we are drawing this cell, we find the area of centropela is moon-like, or it looks like a kissing mouth with surrounded by hemoglobinized area. This is what we call a stomatocyte. So this is the one which is the slit-like or moon-like shape or kissing mouth-like, found in conditions like electrolyte imbalances, found in liver disease, actually found in chronic alcoholism, in liver disease, find them there, the stomatocytes. And we can also, so maybe that's where we find these in electrolyte imbalance, we find them in chronic alcoholism and sometimes severe liver disease. And these stomatocytes, we can also find them in hereditary. They can be acquired as hereditary stomatocytosis, whereby you are born without, whereby the membrane of the red cell is a defect, that is the ankyrin and the spectrin, and there is increased efflux. So this stomatocyte is due to increased efflux, that is outflow of potassium ions due to the cell membrane defect. That is what we can talk about the stomatocyte, seen also in hereditary stomatocytosis. Another one we can see is spherocyte. This spherocyte is also due to red cell membrane defect of ankyrin and spectrin, whereby there is increased influx. Here it is due to increased influx, that is inflow of sodium ions in the cell. And whenever sodium ion is reabsorbed, even water is reabsorbed, making this cell to become turgid and lose area of centropela. So this one is dense staining. It is small, dense staining cell with no area of centropela. With no area of centropela. No area of centropela. And on drawing, we find that this cell is very small. It's small in size and it is dense. It is densely stained. Stain is dense with no area of centropela. The stain is deep pink or dense pink with no area of centropela, and very small in size, seen in severe burns. You can see it in severe burns. You can see this one in toxins. We can see this spherocyte in toxins and severe burns. We can see spherocyte being formed, and also in hemolytic anemias. Some hemolytic anemias, we can see them, spherocytes, and still we can see it in hereditary spherocytosis. hereditary spherocytosis, you can see them. And sometimes blood transfusion reactions, blood transfusion incompatibility reactions. Whenever you receive blood and is incompatible, we can see spherocytes being formed, or we can also see them as inherited due to effect of aspartame and ancrin. So this is what we are talking about. Then number 5, among the poikilocytes still due to red cell membrane defect is elliptocytosis, elliptocytes. And these elliptocytes, they are elliptical in shape, or we can say that they are cigar-shaped cells with round ends, and the diameter at the center, is the same at the periphery. So the diameter at the center and the periphery is the same, and it is like a cigarette, or what we are calling cigar-shaped. So when we draw this cell, we find it has round ends. With the diameter at the periphery the same as diameter at the center, and it has no area of centropela. No area of centropela in this cell. And this one is seen in conditions like hereditary elliptocytosis. That is inherited. We can see it, this condition, in megaloblastic anemia. You can see it in megaloblastic, these cells also seen in megaloblastic anemias. Or sometimes these elliptocytes are seen in myelofibrosis. Those are like leukemias. You can see these elliptocytes. In another cell we can talk, so these stomatocytes, spherocytes, and elliptocytes, they are due to red cell membrane defect. So another cell we can look at is a pencil cell. Number 6 is a pencil cell. And this pencil cell is a narrow, elongated cell with sharp ends, and no area of centropela. So when we draw it, it looks like a pencil. It has round ends and no area of centropela. And we can see for it, the diameter in the periphery is not the same as diameter in the center. It is seen majorly in iron deficiency anemia. Seen majorly in iron deficiency anemia. Another cell we can discuss in this session, which is number 7, is cystocytes, or what we can call fragmented cell. So cystocytes, these are fragmented cells with blunt ends, or what we call blunt spicules. And this cell, for it you find it is fragmented cell with blunt ends and no area of centropela. It has no area of centropela. So this cell is known as a fragmented cell, or what you call a cystocyte, And the cystocytes are seen in conditions majorly in hemolytic anemias. We see in hemolytic anemias like burns, like DIC, that is disseminated intravascular coagulation. We see it in microangiopathic hemolytic anemia, that is MAHA, and sometimes we can see it in major hemolytic anemias. We can see it in severe burns. We can see it in toxins. Whenever there are toxins, like from bacterial toxins, we can see formation of fragmented red cells. So these are the cystocytes. And another cell we can discuss about in this session, it is blister cells. But maybe before blister cells, we can talk about keratocytes. And the keratocyte, this one is formed whereby we saw in the previous video Hen's bodies that when a cell looks like a bite out cell, whereby at one point it looks like a bite out, and it has the area of centropella. So this cell, it is a bite out cell. It has one place whereby it is a bite out cell with area of centropella. And it is seen in conditions like glucose 6-phosphate dehydrogenase deficiency. We see it in pyruvate kinase deficiency. You can see it in MAHA, that is microangiopathic hemolytic anemias. We see it in DIC and oxidant drugs. We find keratocytes, which is a bite out cell. Where the Hen's bodies are, the spleen bites that bite up, forming a keratocyte, and the keratocyte, another name is called the bite cell. So we can see them, whenever we see them in a thin film, we suspect these conditions. As we continue, we can look at other cells under this, and other cells we are going to discuss. So number 9, we can discuss about blister cells. Blister cells, you can call them half-ghost cells. And these blister cells, the description is that they are hemoglobinized, or the hemoglobin is concentrated. The hemoglobin is concentrated on one side, leaving unstained area with fuzzy membrane. The membrane is fuzzy. So the HB is concentrated one side, in that if I draw this cell, this is a red cell, the hemoglobin is concentrated one side with no area of centropella, and the membrane which is left behind is fuzzy. So it looks like lady's handbag. That is a half-ghost cell, and its other name, you can call it half-ghost, or you can call it helmet cell. This cell is also seen in the same condition as keratocyte, that is glucose phosphate dehydrogenase deficiency. You can see it in DIC, that is intravascular coagulation, disseminated intravascular coagulation. We see it in microangiopathic hemolytic anemia and oxidant drugs. You can see it there. So this is a helmet cell, or what we are calling blister cell. Number 10, we can discuss another cell or another poikilocyte we can discuss in this session is a acanthocyte. But before acanthocyte, we can look at crenated cell, or what you can call echinocyte. This echinocyte, for it is surrounded by a spicule. It has short, evenly distributed spicules with equal length. These are short, evenly distributed spicules along the membrane of the cell, and they are of the same length. And this cell has area of central pillar. It has area of central pillar. So if I can draw a red cell like this, you find it has short spicules of equal length, widely distributed all over the cell. This is what we call echinocyte. And it has area of central pillar. It is majorly seen as an artifact, but apart from being seen as an artifact, we find it in conditions like uremia. We find it in pyruvate kinase deficiency. Which is an enzyme of glycolysis. And these are the major conditions where we can find echinocyte, what we are calling crenated red cell. Then number 11, we can talk about acanthocyte. And acanthocytes, for them, they have 2 to 12 spicules or projections, and of an equal length. These ones have an equal length, and they are not evenly distributed and have no area of central pillar. You have 2 to 12 spicules of an equal length, and they are not evenly distributed. In these cells, you find, if this is a red cell, here it has a spicule, then it has another one here of an equal length, it has a short one, it has another long one with no area of central pillar. This is what is known as acanthocyte. These acanthocytes are seen in hereditary acanthocytosis, seen in liver disease. You can see these acanthocytes. Acanthocytes can be seen in beta lipoproteinemia. So any defect with metabolism of fats, we see acanthocytes present. And these acanthocytes can even be seen in neonatal liver disease, what we call neonatal liver disease. So these are the conditions where we can find acanthocytes. So as we are towards concluding this video, number 12 and number 13, we can talk about under poikilocytes. can discuss about Rulox. Number 12, we can talk about Rulox formation. And these ones look like piles or stacks of coins. Stacks of coins. So you find where the cells are piled up together like stacks of coins. So these cells are piled together like stacks of coins. So you find they are piled together like stacks of coins. This is what we call Rulox. And these Rulox, they are seen in hemolytic anemias, but we normally see them in multiple myelomas. Multiple myelomas. Myelomas, you see them in hyperproteinemia. You see them. So multiple myelomas and hyperproteinemia, we find them, and even blood transfusion reactions, you can find them there. So these are Rulox forms. You find they are like stacks of coins, or sometimes they can be like this, piled up together like stacks of coins. That's what we are calling Rulox. And even there is another one known as agglutination. And agglutination for them, here the cells join together completely. So different cells aggregate together. Aggregate together. So you cannot distinguish which one is a cell and which is not a cell. And these ones, so you find the cells are piled up, they are together. You can't even distinguish which is a cell and which is not a cell. Are also seen in the same reactions like inflammatory disorders, chronic inflammatory disorders, seen in multiple myelomas, and blood transfusion reactions. Then lastly, what we can talk about is the teardrop, what we call poikilocytes. Lastly, we can talk about a teardrop and ovarocytes. So number 14, we have teardrop, or we can call it dacrocyte, and this one is pear-shaped, or it looks like a falling leaf, pear-shaped cell with one sharp projection. One sharp projection. And this teardrop, which looks like a falling drop, so if we draw it, it looks like this. The teardrop with area of central pillar. It has area of central pillar, and it is seen in megaloblastic anemia. Megaloblastic anemia. We see it in some hemolytic anemias and in myelofibrosis. You can see them. So lastly, we are going to look at ovarocytes. So myelofibrosis. So lastly is number 15. among the poikilocytes. This poikilocyte is known as ovarocyte. And this ovarocyte, as its name suggests, it is oval in shape. It is ovoid in shape. It is oval in shape. It looks like an egg. It is oval in shape with area of central pillar. Area of central pillar. And this ovarocyte, which looks like an egg, is oval in shape with area of central pillar, seen in liver disease. Liver diseases whereby these cells are always bigger in size. In liver diseases, these ovarocytes, and sometimes in megaloblastic anemia. So these are the different poikilocytes we have discussed in this video, whereby we have looked at 15 poikilocytes seen under thin film stained with Romanowski stains. Hope you have enjoyed, whereby we have seen guys like sickle cells, we have seen which we call drepanocytes, we have seen different cells like pencil cells, we have seen cystocytes, keratocytes, we have seen blister cells which look like half ghosts, where the hemoglobin is on one side. And we have given the poikilocyte description, diagram, and conditions. And whenever this is very commonly asked in exams, so if you are a medical student and you're doing hematology, always make sure you enter in an exam when you know these different cells, especially when you're talking about classification of anemias. Thank you so much for listening. May the good Lord bless you.